Breast cancer is a type of cancer that affects the cells in the breast tissue. It is the most common cancer diagnosed in women, and it is estimated that approximately 1 in 8 women will develop breast cancer at some point in their lifetime. Breast cancer is also diagnosed in men, but it is much less common, with less than 1% of breast cancers occurring in men. Breast cancer is caused by the abnormal growth of cells in the breast tissue. These cells can form a lump or a mass in the breast, which can sometimes be felt during a physical exam or seen on a mammogram. There are different types of breast cancer, including invasive ductal carcinoma, invasive lobular carcinoma, and ductal carcinoma in situ. Invasive breast cancer means that the cancer has spread outside of the ducts or lobules in the breast tissue, while in situ cancer means that the cancer is still confined to the ducts or lobules. There are several risk factors that can increase a woman's chances of developing breast cancer. Some of these risk factors are out of a woman's control, such as age, gender, and family history of breast cancer. Women over the age of 50 are at an increased risk of developing breast cancer, and women who have a mother, sister, or daughter who has had breast cancer are also at an increased risk. Women who have inherited certain genes, such as BRCA1 or BRCA2, also have an increased risk of developing breast cancer. There are also several lifestyle factors that can affect a woman's risk of developing breast cancer. These include being overweight or obese, not getting enough exercise, and drinking alcohol. Women who have never had children or who had their first child after the age of 30 are also at an increased risk of developing breast cancer. Preventing breast cancer is not always possible, but there are steps that women can take to reduce their risk. These include getting regular mammograms. Mammograms are the best way to detect breast cancer early, when it is most treatable. Women should talk to their doctor about when to start getting mammograms and how often to get them. Maintaining a healthy weight. Being overweight or obese can increase a woman's risk of developing breast cancer, so it is important to maintain a healthy weight through diet and exercise. Limiting alcohol consumption. Drinking alcohol can increase a woman's risk of developing breast cancer, so it is important to limit alcohol consumption to no more than 1 drink per day. Breastfeeding. Women who breastfeed their children have a lower risk of developing breast cancer. Quitting smoking. Smoking is linked to an increased risk of several types of cancer, including breast cancer. Quitting smoking can reduce a woman's risk of developing breast cancer. Understanding family history. Women who have a family history of breast cancer should talk to their doctor about their risk and any steps they can take to reduce it. In conclusion, breast cancer is a serious disease that affects many women around the world. While there are several risk factors that can increase a woman's chances of developing breast cancer, there are also steps that women can take to reduce their risk. By getting regular mammograms, maintaining a healthy weight, limiting alcohol consumption, breastfeeding, quitting smoking, and understanding family history, women can take control of their breast health and reduce their risk of developing breast cancer.